And good morning once again. It's Monday morning. It's time for Senior Talk. Brought to us each Monday morning by Harbor Place, a senior retirement community in Port St. Lucie. Today we are joined by Diann McDonough. She's the Director of Sales there. And Diann, if you'd be so kind, please introduce this morning's special guest.
I will. Good morning, Paul, and to all our listeners. Well, I have someone dear to me who's male, Caucasian, 54 years old, sun-bathes. Occupation is in the sun. His father had skin cancer, and now his brother. I've pointed out a few questionable spots on his legs and back. He is being stubborn about seeing a doctor for a full-body skin evaluation. I personally can't understand this. I am hoping our next guest, Donato A. Viggiano, medical doctor, can shed some light on why some ignore the signs of skin cancer and what are the risks. Good morning, Dr. Viggiano.
Good morning.
Please tell us more about, and our listeners, about your medical training.
I'm a plastic surgeon. Plastic surgeons go to medical school, and after that, you do general surgery, which I completed, and then 2 years of plastic surgery training after that. So when I finally got into practice back in 1982, I moved here. I was 31 years old. And as a plastic surgeon, I was trained to do skin cancer work, reconstruction of all types, and cosmetic type of operations as well.
Tell us about where your office is located, the name of the office, and some contact information.
My office is presently on Port St. Lucie Boulevard. I've been there since 1990, thereabouts. And it's 1901 Southeast Port St. Lucie Boulevard. The phone number is 335-7477.
Great. Prior to the show, you and I were talking about cosmetic surgeons and plastic surgeons. Could you share with us the difference?
If an individual physician states that he's a plastic surgeon, that means that he's gone through formal training in plastic surgery, which typically is 2 to 3 years after usually general surgery and certainly after medical school. If an individual only uses the phrase cosmetic surgery, it's likely that they did not have formal training as a plastic surgeon, certainly as a plastic surgeon, and probably didn't have formal training even in cosmetic surgery. So they might be a gastroenterologist, a general surgeon. They could even be a psychiatrist and do cosmetic surgery legally.
You know, it was interesting how you were explaining why they call your profession plastic surgeon, the word plastic.
The term plastic, it seems to have a negative connotation that things are not made properly and they're cheaper. But the beauty of plastic, and the reason it's called plastic, is that the term comes from the Greek plastikos, which means to change or to form. And the beauty of that product is you can make any shape, and that's why your keyboards are made of plastic and your telephones have a lot of plastic in it, because they can make any shape. And therefore, plastic surgeons, the reason we're called plastic surgeons is because we can make things, we can shape things. For example, I've had a patient in which their nose was involved with cancer, and I had to remove the nose in order to cure the cancer, because curing cancer is a surgical problem, and I'm a surgeon. And so I cured it, but now I had to reconstruct it. And that takes several steps, and when it was complete, I essentially had rebuilt her nose. So she didn't have a God-made nose, she had a man-made nose. She can go to Publix and no one would stare at her.
Well, today's show, we're going to base it on skin cancer. No one wants skin cancer. No one wants to look prematurely old. What causes skin cancer and the appearance of skin aging?
I'll have a patient come to my office and they'll say, my skin just looks old. And they will point usually to the back of their hands or their arms or their face. And I'll say to them, that is not old. That's not aging. If you look on the inner aspect of your upper arm, or if you look in women on their breasts or on a person's rear end, for example, the areas that have not gotten sun exposure, that skin looks good. It doesn't have all the spots on it, doesn't have all the wrinkles. That's what this aged skin looks like. What they're showing me is sun damage, and therefore, the best way to look the best you can, as long as possible, is to protect yourself from sun exposure.
Some older people have skin that looks younger than other older people. Why is this?
Well, there's several factors. One is where you live, because if you live further from the equator, you get less sun exposure. If you wear more clothing, you get less sun exposure. Those people who are naturally darker, if they have dark skin from birth, then they are naturally protected from sun damage. If you are a person whose ancestry is from Northern Europe, England, Ireland, Germany, your skin is lighter, and because it's lighter, it's going to be more likely to be sun damaged from our sun here in Florida. If you look at the latitude of, let's say, Germany, and take that latitude, how far from the equator are they, and bring it to the New World, that's well into Canada. It's much further north than Quebec. If you take Florida and bring it to the Old World, we're down into Africa. We're in Sudan. So if you take a light-skinned person and you bring them into Africa, they're going to get sun damage. And so we, as North Americans, so many of us, need to protect ourselves from the sun.
Before we continue, I just want our listeners to understand something. You are a plastic surgeon. Are you a dermatologist? Why are you qualified to diagnose skin cancer and treat it?
Plastic surgery involves several types, several fields. One is hand surgery. My training is in hand surgery as well as cosmetic procedures, so facelifts and eyelid surgery and that sort of thing. We're also trained in reconstruction, and as I mentioned to you, the curing skin cancer, the gold standard is surgery. And as a surgeon, we are trained to cure skin cancer. But we're also trained to cure skin cancer in such a manner that when we are complete doing that, you get the best cosmetic and functional result. So when someone has their cancer cured, the best compliment they can tell me is, my friends never noticed that you did anything to cure that cancer. That's ideal. That's the perfect situation.
Thank you. Since we all need vitamin D, and ultraviolet light allows the skin to make vitamin D naturally, how much time should I spend in the sun to get all the vitamin D I need for the day?
And that, again, depends on several factors. One is, what is your natural skin color? If you are naturally darker skinned, it will take longer to get the vitamin D that you need. If you're lighter skinned, it will take less time. To give you a sense of how much exposure, sun exposure, you should have in a day, if you're a light-skinned individual and you're wearing shorts or a skirt, you're wearing a short-sleeve shirt, and you go out in the sun, you will get, here in Florida, you will get all the vitamin D you require for the day in about 15 minutes. Anything much more than that, you're not getting more vitamin D. Your body cannot store it well. It's excreted. It's gotten rid of. And all you're doing is causing your skin to age. You're increasing your risk of skin cancer. So in a bathing suit, probably more like 10 minutes would be all you need.
Why does ultraviolet light cause skin cancer in aging skin, but violet light does not?
If you look at light has a spectrum, it's called. The spectrum is well beyond the rainbow spectrum that we can see. It goes down into the infrared and radio waves and up into ultraviolet and X-rays. We can only see a very small portion, the visible light. If you look at violet light, as in all light, comes in photons, comes in packets, and a packet of violet light just isn't strong enough to cause damage to chemicals in your body, like your DNA, for example. Ultraviolet light, that photon, that particle of ultraviolet light, has now reached a threshold. It now has enough power that it damages your chromosomes, damages your DNA. Once that occurs, that damage can be repaired, and most of the time it is repaired, but it's not always repaired properly. So you damage your DNA about, they figure you're probably damaging your DNA about 1,000 times a second every time you go out in the sun, but the vast majority is repaired. So ultraviolet light just has more oomph to it, has more power, X-ray even more so, and as you get higher and higher, the gamma rays, for example, get much more damaging, cause more chromosome damage. Once the chromosomes are damaged and they are repaired incorrectly, you now have permanent DNA damage. So you've genetically modified yourself. You are now a GMO on your skin, and that is permanent. Even if you do it when you were a child, it's still with you as an adult.
Has ozone depletion caused more skin cancer in Florida?
There's so many things that we are taught, and ozone is critical for life on the planet. However, the ozone holes have been mostly in the southern hemisphere over Antarctica, and not many people live there, and a little bit in the northern hemisphere. There's never been an ozone depletion over any populated area except Helsinki in Finland. So no, ozone holes has not affected us here in Florida or anywhere else in the world except northern Finland for 1 year and yearly down in Antarctica. The ozone hole has been improving, and the reason it's been improving is because we know now what's been causing it, and those chemicals which are causing it have been outlawed worldwide.
Does getting a tan protect the skin from further ultraviolet light?
The reason that we get a tan, and those people who can get a tan, the reason that they do is because tanning does protect the remaining DNA in the cell. So imagine tanning as a callus. If you wear ill-fitting shoes, you're going to build a callus. The body will only do something to protect itself if it's required to do so. So when you get a tan, what you're seeing is your body putting out the energy to form this tan because you're hurting it, and you cannot get a tan without your body responding to a harm. You're being injured. There are some people from Ireland, for example, is a good example of that. They cannot tan. They just don't. They burn. They can't protect themselves from sun damage with tanning. If you're born naturally with dark skin, different issue, because that's a natural phenomenon. And the reason that dark-skinned people are dark is because, as we all know, we've all come out of Africa. We were all dark-skinned at one time. As we moved further, as some humans moved further into Europe, they're dark-skinned, further from the equator, clothing. The issue was vitamin D. They weren't getting enough vitamin D. So if you had dark-skinned and you were clothed, you got rickets. And rickets causes bone weakness, and you died. And so the dark-skinned people, as they moved further and further north, could not survive back in the day when vitamin D was an unknown factor. So that's why there are light-skinned people. Then you take those light-skinned people and put them back in the equator area, or you bring them to Florida, it's just too much sun, and it's damaging to them.
Some people feel a tan makes them look better, and they'll tell you it makes them feel better. How do you feel about tanning salon booths?
One of the wonderful things that the tanning salon people will tell you is that there are several types of ultraviolet light. There's ultraviolet A, which is the tanning ray, ultraviolet B, which is the burning ray, and the beauty of the B is that it reminds you that's the burning ray. And there's also another one called ultraviolet C. Now, what the tanning salons have done is they filtered out the burning ray and certainly the ultraviolet C, and so they generally, if a person can tan, they will tan in a tanning salon. They won't burn so much. The problem is that ultraviolet A, causing tanning, also causes skin cancer and aging of the skin. So if you want wrinkles, you want dyspigmentation, in other words, brown spots, then a tanning salon would be one way to do that. But that's a temporary improvement with tanning with a permanent damage.
Doctor, we hear a lot about sunscreen. How does it work possibly? Is there a certain number you have to go to protect children or yourself, for example?
The recommendation has been between an SPF of 15 to a 30, and most Most people are now moving towards saying SPF of 30. SPF means sun protection factor. And what a 30 means is that if you were to burn in 1 minute and you put this on before you go out in the sun, you will now burn in 30 minutes. So it's really a fraction. So an SPF of 30 means only 1/30th of the ultraviolet light gets through. And it works. It truly does work for about 2 hours. And then it rubs off and it comes off in the pool and in the ocean. And then you got to reapply it. And that's the problem. People, it's kind of greasy. Who wants to do this? The sand gets on it, whatever it is, and they don't want to do that. But if you do it, it works, just like wearing clothing.
The other question I have, African Americans, are you able to spot skin cancer in an African American?
I've been in a practice here in the community since 1982. In that period of time, I've had one African American individual with a skin cancer. And this was a fellow with a very prominent lower jaw and a prominent lower lip that rotated out so you could actually see the pink part, the inside of his lower lip. And that's where the cancer grew, because that part was not protected naturally. If you had to pick the best skin possible, it's dark skin, naturally dark skin, not tanned skin. So when I see someone that I look at and I say, that person's a light-skinned person with a tan, I'm thinking, that's like smoking a cigarette. That is a really bad thing. You should not do that. And you are not attractive. In my mind, now they didn't ask me, but in my mind I'm thinking, that's foolishness. Why do that?
Well said, Doctor. Well said. To those tourists that are coming to visit in Florida, we just talked about sunscreen. What other protection can they use at the beach? Some may think an umbrella is enough. It's a cloudy day. I don't need any of that. I'm going to be in the water most of the time. I'm not going to need sunscreen. What would be your advice?
Part of the reason that people who come down from Michigan and they go right to the beach and they're getting a tan is because they want, especially in January and February, they want, at some level, when they get back home, for people to say, "Oh, where'd you go? You look great." Well, they don't look great. They look burnt or they look over-tanned, but they did go to a sunny climate. And if you come from upstate New York or you come from North Dakota, I can understand why you would want to get out of there in the middle of the winter. I get that. However, you're still damaging your skin permanently. And to do that just so that people can say to you, wow, where'd you go? It seems foolish to me. An umbrella does not protect you. It decreases the ultraviolet light by 40%. It's not 100%. The water doesn't protect you. You have to go down 60 feet in clear water before the ultraviolet light is attenuated, is decreased, unless it's murky water, which people don't want to swim in.
Is it true that if you have a screen over your pool that reduces some of the violet rays?
That's right. It depends on the mesh of the screen, but it runs about 20 to 25%, roughly. Still, that's not an SPF of 30. It just isn't. It's more like an SPF of 4, which is not recommended. It's just too little. Clothing similarly. Some clothes, the tightness of the weave, if it's a tighter weave or you have multiple layers, you can get really excellent SPF coverage. But a typical T-shirt runs about an SPF of 4, maybe 6, something like that.
And speaking of seniors, have you heard stories of how they sunbathed back in the 1930s, 40s, and 50s? It's interesting how they tell me that they used oil, cooking oil. They used a metal screen. Are you seeing the damages, especially now as they're aging into the 80s and 90s?
It just cracks me up. They used to use iodine. I don't know what that was all about. Cooking oil. I think they just felt like they were basting themselves. And I think, no one would put themselves in the oven and turn on the broiler. It just doesn't make a lot of sense. It's not comfortable. It's just foolishness. And if people say, oh, you look better with a tan, why is that? Why can't you just look good, whatever color you are, and just remain that color? If you have straight hair, why don't you leave it straight? Why are you trying to curl it, make it curly? And if you have curly hair, why are you trying to straighten it? Just leave it alone. You're beautiful, you're handsome, just the way you are.
Is that why they wear makeup? Is that why they wear makeup and lipstick and all those things, Diann?
Well, I like makeup. I'm not giving that up. Sorry, doctor.
So a patient will come to my office and will say, I came because I want an exam for skin cancer, and a woman will say, I didn't wear makeup. And I'll say to them, I didn't either. And really, they don't need, frankly, from my point of view, women don't need makeup. But, okay, that's what they want to do. At least it's not harming them. You were mentioning also about a cloudy day. I've heard this. Well, Doc, I went to the beach. It was cloudy the whole day. And when I got back, I had a burn. It must be a wind burn. And I think you people have heard that phrase, wind burn. In other words, if I sat in my room and I turned the fan on high, if I stayed there long enough, I'd get a burn? Does anybody believe that? That is not the case. What's happening is you're outside. It's cloudy day. You don't see the visible sun, and it seems dark, but ultraviolet light goes right through that. It just doesn't see it. And so you're getting the ultraviolet light. You're still getting sunburn.
As we were talking back in the 50s and 60s, how they sunbathed, talking about smoking, using cigarettes, I think it's a lot to do with education. And unfortunately, it's a result of them not having that back then and what the side effects are. So it's good that you are doing this. And it's interesting. I know you're going to high schools now and trying to get to them before there is a situation.
I had a student about 4 months ago. She's a college student, and her skin is pristine. She's beautiful. Her skin was gorgeous. And she came to see me because she wanted to spend a few days seeing what I do, because she's thinking of going to medical school and whatnot. And she said, Dr. Viggiano, you don't remember me, but I was in 9th grade when you gave your skin cancer talk. And when I give the skin cancer talk, I show them the worst pictures. I mean, I tell them in advance, I am going to show you things that you are going to try to hide your eyes. And keep in mind, pictures can't harm you, but going out in the sun can. And I'm trying to scare you. That's my point. And she said, you scared me. I didn't go out in the sun after that. And I said to her, it's obvious your skin is gorgeous. Light-skinned, gorgeous.
Fantastic. Again, tell us about your office location and contact information. We may be going into news break, and I just want to make sure that everyone tunes back in. We're going to have a lot more information about skin cancer and the types of skin cancer. We're going to get in details about that. Go ahead, Doctor.
I've had my office on Port St. Lucie Boulevard at 1901 Southeast Port St. Lucie Boulevard. It's about half a mile off of US 1, heading toward the west, since 1984. And it's been a great location. The population in Port St. Lucie and the area is just wonderful. I feel like they're my friends, and I love to see them. When people come to my office, I feel like they've come to my home, and I'm happy to have them come.
You're almost like a celebrity. It doesn't matter when I bring up your name with our office employees, with residents at Harbor Place. They come and see you. They say that you are their doctor, and they're very happy with your services. So congratulations. You really served our community well these past, actually over 20 years now.
It's more like 34 years at this
point.
point.
Oh, okay, 34.
That is over 20, is it not? I enjoy people. And one of the things I recognize when a patient is sitting down, I find myself sitting down lower than they are so that I'm looking up at them. Because, come on, physicians can be scary. And looking down, looking up at the patient is a way to ease some of that fear.
Good way to end the half hour.
Excellent. Yes, it's going on very, very well, Doctor. It's been a lot of questions coming up. I got a couple about being beautiful again. But anyway, this is WPSL. We're in Port St. Lucie. The time is now 10:30. It's time to go to news in the bottom of the hour from the Florida News Network. Hey, good morning and good afternoon. I guess it's still the morning, 10:30 here, but we're having a good time. And you're on Senior Talk. Today's guest, I'll bring it over to Diann McDonough, who's the sales director down there at Harbor Place. Diann, please reintroduce our guest this morning.
Viggiano here. Dr. Viggiano.
Oh, good morning. Yes.
Fantastic. I just want our listeners to know that plastic surgeons are people too. So I want to do a little human interest on you. And I hear that you have a T-Bow in your family as well.
Yes, T-Bow is a dog. T-Bow is a service dog, actually, and she's a she, even though her name is T-Bow. My stepson has a seizure disorder, and so we have a seizure dog. That dog goes everywhere. It's a beautiful thing to have a service dog that you can bring everywhere, and she's a sweetheart. And she's a German Shepherd, and the reason we got a German Shepherd is that, no one fools with German Shepherds. So if my stepson is out and about, he's got his dog with him, and he's somewhat vulnerable, but not with Tebow around. And when Tebow gets her vest on, she knows she's at work, and she behaves differently. She knows when he's going to have a seizure, and she warns him about 20 minutes before. It's a remarkable relationship. If I'm home with Tebow and Evan is away, my stepson, she is not herself. She is standing at the window. When is he coming home? So it's wonderful.
So you have Tebow the dog, and you also have a cat. What is the cat's name?
The cat's name is Cat. Very remarkable that we came up with that name. And she's just as sweet as Tebow. So I come home and I have 3 very sweet women in my home. I've got a cat named Cat, I've got a dog named Tebow, and I've got my wife named Kim, who is also my office manager, and one is more sweet than the next. So that's a lovely thing.
I always say a part of living is giving. How have you given back?
I think I'd like to think I give back in several ways. One is when a patient comes to my office, I think of them as my family. And just that alone is giving back. So this occurred many years ago. I've been here 34 years. About 32 years ago, I had a patient had a problem, and I didn't know what to advise them. There's a lot of possibilities. And then I thought, suppose she was my mother. And instantly, I knew exactly what I would tell her if she were my mother. And so I always do that. So a patient comes to me, even subconsciously, I'm thinking, that's my brother, that's my sister, that's my cousin. What would you say to them? And it's always quite clear what I would say to them. It comes instantaneously. And that's giving back. And the other way to give back, I think, so treat people with respect. The other thing giving back is I've taken trips to Nicaragua and Honduras and to Haiti. The one trip to Haiti was right after the earthquake. Had a remarkable experience. What a country. What a shame that their government is their government. I think it could be a much better place to live, but it is not. Nicaragua and Honduras, similarly, they're better off than Haiti. And those countries I've been to multiple times, both Honduras and Nicaragua, for I did skin cancer work there, but skin grafting for chronic wounds, cleft lip, cleft palate, and the payment for that, the amount of money I get for that is zero. I get nothing in terms of cash. But my goodness, what you get is so much more valuable because you walk away feeling so good, and you can't buy that. That is a wonderful, wonderful experience. And they're so appreciative. And when I go down there and I have my surgical cap on, it's an American flag cap. I want them to remember who we are, that we came out of our way, no cost to them, cost us, but we get paid in a different way. It's a lovely thing.
With that note, we are going to go back to skin cancer and talk about the different types of skin cancer. What is the most common skin cancer?
The most common skin cancer is basal cell carcinoma. It runs about 80%. There are so many basal cell carcinoma in the United States that it outnumbers not only all the other skin cancers, but all cancers combined, including colon cancer, breast cancer, any other kind of cancer. Fortunately, it's also the most curable. All one has to do is cut it out, just physically remove it, and remove it in such a manner that its margins are free of the tumor, as the pathologist would say. In other words, you've cured it. Once you have that defect, then you have to repair it. That's where surgeons come in. That's where plastic surgeons come in. Repair it in such a manner that you can't tell it was ever there. The next type is a squamous cell carcinoma. It runs about 17%, thereabouts. It's more aggressive. It can metastasize. Metastasize is a word people have heard and maybe don't understand. If a woman has breast cancer, how does that kill them? Well, you can remove their breast. That doesn't kill them. But what happens if you remove their breast and the cancer has already spread through their lungs? It doesn't matter what you do. to the breast. And the same thing with squamous cell carcinoma. If you have that on the skin and I cure it from your temple, but you already have lymph nodes involved in your neck that I don't know are there, or they have squamous cell carcinoma in your lungs or your liver or your brain, which is where it goes, that's what kills you. It's not the cancer in the skin. The last one, the most of the common ones, are melanoma, and it runs about 3%, and it metastasizes even more frequently. Therefore, when I see a lesion that I think, a spot on someone's skin that I think might be a melanoma, I want that off, and I want that off yesterday, because if it's already spread, if you wait too long and it's spread to their liver, it doesn't matter what I've done to the cancer on their arm. It's already in their liver. So you want to get that soon, and that's called metastasis, and you really want to get cancers cured before that. Basal cell carcinoma essentially don't metastasize. There's been some reported cases. I've seen a couple myself, rare. I remove 800 cancers a year, and in the last 34 years, I've seen 2 metastatic basal cell carcinoma. That's pretty rare, but it happens.
All right. So it was basal. Run through it one more time.
Basal is the most common, about 80%, more common than all other cancers combined. Squamous cell, less common, more aggressive, can metastasize 17%. Melanoma is about 3%.
Okay.
How does a person know he or she has it?
Oh, isn't that a good question? I had a patient come in who had this really ugly thing on his temple. It was the size of a $50. It was bleeding. It was just disgusting looking. And he said, I'd like that off. And I looked and said, okay, easy to get that off. Let me look you over. And I looked him over because that's what I do. I examine patients. And I looked at his back and I said, that thing that you came in for that really looks bad is harmless, can't hurt you. It just doesn't look good. I'm going to remove it. But this thing on your back, I'm worried about. And it, in fact, was a melanoma. So my point is, often a patient will come in, point out something, I'll go, that's okay, but that over there is not. And how do I know? If you were in a crowd and you had a loved one in the crowd, your sister, your mother, your brother, you could easily recognize that person, even though it would be tough for you to describe that individual to somebody else so that they can tell who that person was. That was the person we're looking for. So for me to say to you, how can I determine by looking what a cancer is, I really could not do that very well, because they're like family. They have their personalities. However, if you have a wound that you say, gee, I'm wiping my face and now I got blood on my towel, and you look in the mirror and you see something bleeding on your nose or on your cheek or on your forehead, what happened there? I mean, why would it start to bleed? What's the injury that caused that? Now, if you say, well, I was picking on a pimple, okay. But if you don't remember doing anything to cause that wound, you did something to cause that wound, but you did it over your lifetime. It was sun damage, probably. That needs to be checked.
Well, now, when we go to our family doctors for physicals, we see them once a year perhaps, typically they're qualified to spot skin cancer? Because not everybody comes to you for a physical, obviously, so we have to trust our family doctors to have that knowledge.
And the physical I do is a skin physical. I don't listen to their heart necessarily, that sort of thing. I'm a associate professor of plastic surgery for Florida State University. I get medical students come in, and every year, this year I'll have 4 medical students, each for about a month, and they are family practice physicians, they're emergency physicians. There are one actually this year for the first time wants to be a plastic surgeon. And when they come to me, and I give lectures to them as well, I tell them the reason you might come to me as a family practice physician is that you are the first line of defense. And if you're looking somebody over, I want you to be able to recognize that looks suspicious and send them on to somebody who can take care of that, or take care of it yourself. And I teach them how to do that. But to have a layperson just by looking, that would be tough. I've seen 30,000 skin cancer. I'm pretty good at identifying them, and even I can't tell. I look at them and go, it's suspicious. Let me just shave that off. Let's find out what's going on before we start doing, excision with reconstruction.
So family doctors, you say, have a difficult time occasionally recognizing skin cancer?
God bless the family practice doctors. They have to know a little bit about everything. And for them to miss something that might be a melanoma or basal cell carcinoma, God bless them for finding anything. I mean, really, because they have to worry about your colon and your lungs and your eyes, everything. And so I would say, show it to your family practice physician. See what they think. And I get quite a number of referrals from physicians in town. But if you really want to be certain, go to someone who treats skin cancer. And that I treat a lot of skin cancer. The dermatologist treats skin cancer as well. And many of the general surgeons and the ear, nose, and throat doctors and other plastic surgeons treat these as well.
Are all types of skin cancer caused by sun damage?
Yes, pretty much that's the case. And basal cell carcinoma is chronicity, how many hours you spent down in the sun. Squamous cell is the same. And this is your lifetime of exposure. So if you got a lot of exposure as a 10-year-old, that increases your risk as a 70-year-old getting a skin cancer. And the reason for that is you go out in the sun, you get a lot of chromosome damage, a lot of DNA damage. It's repaired, but not perfectly. And you accumulate DNA damage, you accumulate mutations. It's thought today that you need about 10 mutations per cell, and they have to be just the right mutations before cancer will form. So children get a lot of sun exposure. They're making these mutations, but each cell might have 1 or 2 or 6. As you get older, 9. Now you see you're at 9. You go out in the sun, you're in your 70s, you get that last one, now you got the 10th one. Now a cancer forms. And that's why it takes so long for it to happen. Melanoma also is related to sun exposure. It's considered to be episodic severe burns. So if you look back when you were a child, oh yeah, I really had blistering burns 3 times. That increases your risk of melanoma.
Is there a golden standard or a gold standard for skin cancer treatment?
The gold standard is excision with reconstruction. Now, they can be frozen, they can be scraped, you can actually have radiation treatment for them. Those are the secondary treatments generally. They're not I personally think the best treatment. I think the best treatment is excision, getting clear margins so the pathologist says, yes, you got this thing cured, and then reconstruction. Another question patients will ask me is, Doc, this is a basal cell carcinoma. Could it become a melanoma? And the answer is no, they're different. We have trees that are palm trees, and we have trees that are pine trees. And it doesn't matter how old the palm tree gets, it's never going to grow up to be a pine tree. It just doesn't happen. And basal cell carcinoma is the same way. What you get is a small basal cell carcinoma, and then it becomes a bigger basal cell carcinoma. And I've seen some the size of my palm. So you wonder what's going on in that person's mind because it bleeds and smells and carries on. But it will never become a melanoma. It'll never become a squamous cell carcinoma.
I've heard a lot about Mohs surgery. What is it? Now, Mohs surgery, I'm going to spell it. It's M-O-H-S.
Dr. Mohs was a general surgeon back in 1935, and he came up with this technique. It's also referred to as microscopic examination of the margins. If you take a piece of tissue and look under a microscope, you can see the individual cells. And if they're bizarre enough, then they start calling them cancer cells. And so the pathologist will look at this and he'll say, oh, here's a cancer cell, here's a cancer cell. When I cut something out and send it to them, they will look to see the cells themselves under 1,000 magnification, and they'll say, okay, here's the cancer cells. And then they look at the edge, and they'll see, oh, there's no cancer near the edge. So it looks like the margins are free of the tumor. You've cured the cancer. And this is like if you have a rotten part of an apple, you want to cut into the good part of the apple to get the rotten part out. You don't just try to scrape it off of there. What Mohs does is it's done by dermatologists only, not surgeons, and they will cut out the cancer, and then they will look under the microscope immediately to do that. So that's microscopic examination of the margins. It's a wonderful technique. The problem is it's overutilized. They use it more than they probably need to use it. Because I do a very similar technique if I need to, and I remove 800 skin cancers a year, and I might use this other technique, which is called frozen section, very similar, type of technique, and I'll use that maybe 10 times in a year, whereas many of the Mohs surgeons, they call themselves, will use it every single chance they get. The official term for this is a perverse incentive to overutilize. Now, why would they do that? Well, they would do that because the differential in payment for Medicare is $1,500 per skin cancer. So the average reimbursement for Mohs is about $1,800. If I cut out a skin cancer, I'll get about $300. The pathologist will get $75 for that, whereas the Mohs surgeon will get up to $1,800 just to remove the cancer. And then there's an addition. You have to reconstruct it. You have to sew it. You get paid for that too. So if you look at the differential, I've thrown around a lot of numbers, it's about $1,500 per skin cancer. That's really lucrative because if you look at what the Medicare pays the orthopedist for a total knee replacement, $1,200. Now, cut out skin cancer, $1,500 additional, or remove your skin cancer, your knee, replace your knee, including all the follow-up, including all the rehab, for $1,200, or general surgeon, $600 for a gallbladder. Oh my, there's a problem here. That's the perverse incentive to overutilize. I had a patient come in, had a basal cell carcinoma on her knee, and the thing couldn't have been bigger than a BB, and they were going to do Mohs surgery on this. You know, you just cut the thing out as a football shape. You got a scar that's maybe 3/4 of an inch. If you did Mohs, maybe you would have a scar that's
Like a baseball, right?
it's a baseball,
Right.
football shape.
Sure.
They say, well, you cut out less cancer, less the normal tissue. Yeah, how much less? We're talking about a 64th of an inch less? Oh, come on. Now, the reason I will do a frozen section technique is if the cancer is so large and I can't tell how big it is. I'm looking at it and I say, well, I know it's cancer. Where does it end? The margin is indistinct. I can't see it. Or it's going into something that's so critical that I really want to save that if I can. I don't want to remove that. Then I will do a frozen section technique. I act as a surgeon. I am a surgeon. I send it to a pathologist who acts as a pathologist. They are a pathologist. And they tell me if I've cured it or not.
And that's 2 eyes now.
That's
now.
2 eyes.
Or actually 4 eyes.
Yeah, 2 on each of us. That's exactly right. Whereas when the dermatologist, the Mohs surgeon does it, they do both things.
Right.
But they get paid for both. That's the beauty of it. You see, they get paid as the surgeon and they get paid as the pathologist. And also, I hate to say, if they can say, they look at the cancer and go, well, I think it's this big. I'm going to take it smaller than I really think I should. Oh, look, it's got a positive margin. I have to take more. They get paid again. They keep getting paid. So if you don't cure it the first time, you don't cure it the second time, you don't cure it the 6th time, you keep getting more money for it. Whereas if I don't cure it the first time, I don't get any cent, but a penny more.
Some double dipping going on there.
Double, triple, quadruple.
Yeah,
That's
yes.
right. Perverse incentive.
That's a shame. I would imagine older folks who perhaps live at your
Right.
facility, Diann,
Yes.
does Medicare scrutinize this carefully?
Unfortunately, it's at the federal level. In the state level, the company that manages Medicare disbursements in the state of Florida, I'm the representative to that company for all the plastic surgeons in the state. There's about 350 plastic surgeons in the state. So I go to their meetings 3 times a year. And when they brought up the Mohs issue, there was a lot of activity in the room. And I'm the plastic surgeon representing them, but there's an ear, nose, and throat doc representing them, gastroenterologist, the hospitalist, all these different people are represented. And there was a lot of anxiety because the general surgeons say, gee, I get $600. They're getting, $1,800. Medicare's running out of money. Next year, I'm going to get $550. So they are the general surgeons. So, yeah, there's a lot of concern. I tell medical students today, if you really want to make a lot of money, be a Mohs surgeon. That's the way to go, at least today. Now, I think that's going to change. It's got to. It's got to.
I have a personal friend who went to a dermatologist, had a Mohs surgery. She had a little, pimple-like on her forehead. She showed me a picture of what they did. Literally, it was probably as big as if you're playing pool, billiards, one of those balls right in the middle of the forehead. It was a gouge. She literally went to you, doctor. You don't know that I was going to tell you this, but she went to you, and you cosmetically tried to do what you could do to make it look more pleasant. Have you seen that a lot where they go to dermatologists, do the Mohs surgery, and now come to you and ask, what happened? Can you help me?
Yes, and there are some plastic surgeons in town that are see a lot more of the Mohs type of patient, which is fine. I just want the patient to be treated properly and treated the best way possible.
So congratulations to you, because she looks beautiful compared to where she did.
Well, you were saying, I mentioned about that company that disperses Medicare reimbursements in the state of Florida. When that whole discussion about Mohs, the gastroenterologist who represents all the gastroenterologists in the state of Florida said, yeah, my office manager had a cancer on her scalp, and after $6,000, she still had the skin cancer on her scalp after all that Mohs surgery, and she was furious that just too much money is being thrown at this. Something needs to be done.
So I'm going to recommend to those listeners, please visit Dr. Viggiano. Doctor, please tell us your location again and telephone number so they can get a free skin evaluation. Not free, complimentary.
There you go. My office is 1901 Southeast Port St. Lucie Boulevard in Port St. Lucie. The phone number is 772-335-7477. I have a website, drviggiano.com, and that you'll see some wonderful things on there, some cosmetic stuff. But you also, if you look at the end of it, there's some of my trips to Haiti and Nicaragua. I have this wonderful little video of a woman who was 72 years old with a cleft lip, never been repaired. And I had the honor, let me tell you, it was a real honor to fix her cleft lip. And you'll see her smile. So if you go to the Dr. Viggiano website, it'll be there.
Please tell us more about the other services.
Well, I do skin cancer checks, of course, and cure cancer every day. But I also do upper lid blepharoplasty and lower. This is eyelid surgery, lower lid surgery, injectables. There are the common injectables like Restylane and Juvederm. People want their 11s, their frown lines repaired, or the creases around the side of their nose repaired, and they work very well. I use another product. It's called Belafil, which has permanency. You put this filler in, and it'll be there the rest of your life. It's a product that has been used for 50 years for various things, and in the last 7 years is being used for injectables. The other person I know who's using it is up in Vero Beach, but nobody else in this area. It's an excellent product, permanent improvement of areas that you want to increase their volume.
Fantastic. Thank you, Doctor, for being on the show.
Thank you for having me.
Yeah, we've got about a minute left. Certainly, the last couple of weeks, Diann has brought us excellent doctors here, and Dr. Viggiano's been very enlightening to a lot of us who have maybe had misconceptions about what skin cancer was or could be. And certainly, so can a person check him or herself in the mirror? In other words, you see things that are developing on your face. Obviously, we're not doctors or qualified, but could we? What should we look for? Is it ears, temple, or is it anywhere?
Typically, it's in areas that are sun exposure, so the face, the back of the arms, the hands, that sort of thing. You would not expect to see it on your abdomen, for example, your stomach. If you see something and you say, gee, I don't remember seeing that before, that might be just that alone might be a reason to see someone who might be able to tell you what it is. On the other hand, you say, gee, let me keep an eye on it. Cancers change, they grow. And if it's changing and growing, then really let someone look at it. It still might be benign. It still might not hurt you, but it's time to be sure.
Very good. Thank you. Diann, you want to give us the address once of your location, please?
Fantastic. Harbor Place at Port St. Lucie is located at 3700 Jennings Road in Port St. Lucie. Our telephone number is 337-4330. Please give me a call. I would love to give you a tour of our Continuum of Care campus with independent living and assisted living for seniors. We also are proud to have Life Care as our sister community with the rehab and great skilled nursing. Again, 337-4330. And thank you, Paul.
Thank you, Diann. This is WPSL, Port St. Lucie, Florida.